Hey y'all, this is Miss Gilligan's group Wednesday. This is Alexa, Haley, Caleb, Keelan, Lexi, Richland, Sydney, and Tanisha. Our group has the Clear Liquid Diet, and this is for our post-conference nutrition project. So definition. So a clear liquid diet is made up of only liquids and foods that are clear liquids at room temperature. So these can be frozen foods, but as long as they are clear liquids at room temperature, then that's fine. Clear liquids are easy to digest and they're used before certain tests and procedures. So some things included in this diet are water, broth, gelatin, plain tea, plain coffee, popsicles and juices without the pulp, clear sodas, and sports drinks. And there's several other options also. Over here to the left, we have a picture. It says eat these foods: water and sports drinks, apple juice and other juices without the pulp, black coffee or tea without cream. So they can have coffee, it just has to be black coffee and they can't have any cream in it. And of course, popsicles, but without eating fruit or yogurt. So they can have popsicles, but they can't have the additive fruit on top or the fruit inside of it. And then skip these foods so they're not to have any solid foods, broth, applesauce, or other soft foods. They can have clear flavored broth. It just can't have any of the solid meats or vegetables inside of it. It just has to be the plain broth. They can't have orange juice or other juices with pulp, and then no milk and other dairy products. So for the milk and orange juice, these are not considered clear liquids because they are not fully transparent, and it may take them more effort for the digestive system to break them down. So that's why we don't want to have those included in the diet. Grape juice is a good option because it is pigmented. It is pigmented, but it's fully transparent. So indications. What patients need this diet and why? So a clear liquid diet might be recommended for patients before or after having a procedure done. So the purpose of a clear liquid diet is to ensure that there is no food in the stomach or intestines that might interfere with a test, procedure, or a surgery, such as a colonoscopy. What is a colonoscopy? During a colonoscopy, a scope is inserted through the rectum to look for any growths or evidence of cancer. If precancerous growths are found, they are removed during the procedure before any cancer can develop. So a clean colon makes it easier to find and remove the growths. This means that they need to prep their bowel before surgery or before the procedure. Bowel prep includes following a clear liquid diet the day before the procedure. So any of the foods we've talked about are the ones coming up, are what these patients need before the procedure to ensure that their colon is cleaned out. So, and of course, this is because we don't want any food or anything interfering with the test of the procedure. A clear liquid diet may also be recommended for patients who are experiencing nausea, vomiting, or diarrhea. So when patients are experiencing nausea, vomiting, or diarrhea, they can't tolerate full diets. So we want to give them something that's going to be easier on their stomach, which a clear liquid diet would be a great option. So that's what would be recommended for those patients. So a clear liquid diet helps maintain hydration, nutrients, and electrolytes in patients who cannot tolerate a full diet. So while that clear liquid diet does offer nutrients, hydration, and electrolytes, it doesn't have enough nutrients and calories for a long period of time. So we don't want to use this more than the time recommended, which is usually about 3 to 4 days, maybe 5 days. And that's because a long time of being on a clear liquid diet and them not offering enough nutrients and calories for that long period of time, it can put our patients at risk for malnutrition. So that's why these are only used for a short temporary amount of time. A clear liquid diet may also be used to allow the digestive tract to heal after some diseases such as diverticulitis, Crohn's disease, or pancreatitis. So these diseases are harsh on the digestive tract, And to give it time to heal, we want them on an easy and a soft, something that's going to be very easy on their stomach, such as a clear liquid diet. This will allow the stomach and the digestive tract enough time to heal for the temporary time this is used for. Some considerations to remember. So many of the foods that are available in the clear liquid diet, they're high in carbohydrates and sugars. Therefore, any of the patients with diabetes mellitus who are on these types of diets, they're at an increased risk of developing hyper or hypoglycemia, which is a high blood sugar or a low blood sugar. So for our patients with diabetes, we want to make sure we monitor their blood glucose frequently, and then make sure they're given their insulin or whatever medication at the required dose. The most common liquids that are used in the clear liquid diet are thin liquids, which places our patients at risk for aspiration. So these patients should be sitting up when they're eating or drinking these liquids, or if they're in the hospital, having the bed elevated, things like that. And make sure we have all of our precautions in line to decrease the risk for aspiration. A clear liquid diet does not provide the patient with enough adequate nutrients and calories. Therefore, this diet should not be used for any longer than 5 days. So this is something I had mentioned earlier, and it is good to remember and take into consideration that we're only going to use this for a few days, because again, it doesn't have enough nutrients and calories. Okay, so here are some more foods to eat. So water, ice chips, popsicles without the fruit, juice without the pulp, gelatin, carbonated beverages, plain tea or plain coffee, strained vegetable juice, so that's just the juice, none of the additive vegetables, broth with no meat, which you can see at the top right of the picture is just plain broth. It has no meat and no added vegetables into it. Clear liquids that are flavored with the sugar, honey, or salt is okay. Hard candies are okay, and so are sports drinks. So the sports drinks are, of course, are things like Powerade or Gatorade. Those are fine. And then in our picture, we have the popsicles, the water, the broth, Sprite, apple juice, and then we have orange flavored Jello. And now here are the foods that we want to avoid. These are going to be grains, milk, juice with nectar or pulp, yogurts or sherbets, chocolate, ice cream, all types of cheese, shredded, sliced, etc. Fruits, fresh, frozen, or canned, are not allowed. Meats such as beef, pork, chicken, or shrimp, and etc. Cereal is not allowed. Vegetables, cooked or raw, and then also alcohol. So mainly the solid foods are not allowed. And then up in our top right corner, we have a list of a lot of the things we already talked about. Apple juice, grape juice, cranberry juice, those are all fine. Those are all pigmented beverages, but they are transparent, which is why they are good for the clear liquid diet. Honey, syrups are good, fine. Fruit flavored ice, that's fine as long as it doesn't have actual fruit, the solid fruit within it. And then, of course, oils, not acceptable. We've talked about some of these: coffee with creamer, tea with creamer, orange juice, prune juice, milk, yogurt, pudding, and ice cream. So additional patient teaching. This diet can make you weak or dizzy if you try to do any excessive activities. So this is something we want to let our patients know, not to take it easy and to not do any excessive activities that might wear the body down. Clear liquid diets should not be used more than 3 to 4 days unless otherwise directed. Of course, we've already mentioned that. Do not drink anything with red or purple coloring. Okay, this is important because Anything that is red or purple coloring can leave a residue within the bowel that resembles blood. So keep this in mind when giving Jello, popsicles, hard candy, or drinks, that anything with those colors that might resemble blood is not a good option, especially whenever they're having a test or a procedure or a surgery done, such as a colonoscopy. Actually, whenever they're going through the rectum and then they see something red and think that it might be blood, but it's actually just red juice. So that's why we want to avoid that. Do not eat any solid foods, of course. Do not drink sugar-free liquids unless you're instructed to do so. Do drink liquids that are different types of clear liquids. So make sure you're getting a variety of things. We're not going to give the same thing every time. Do aim to eat or drink at least 6 times a day and drink at least 1 10-ounce glass of clear liquid every hour you are awake. So that's really important to know. And then, of course, like we had mentioned earlier with our diabetes patients, we want to make sure that if you have diabetes, a clear liquid diet should provide 200 grams of carbohydrates spread equally throughout the day. So that's important, of course, because we said that most of the foods and drinks within the clear liquid diet are high in carbs and sugar. So we really want to spread that out, make sure that we're monitoring their blood glucose and giving their insulin or other meds at the recommended doses. Okay, here's a video that we included in our PowerPoint. This will be posted in the discussion of our PowerPoint. You can just click play and watch it on your own through there. She goes in detail a lot about the clear liquid diet. She has a lot of other food options and drink options, and she goes in depth on what is important about a clear liquid diet. So we thought this would be really good to add into our PowerPoint, and we just wanted you guys to look over it. Now we have a few questions after the discussion. So question 1 says, which of the following foods are not included on the clear liquid diet? And select all that apply. So honey, orange juice with pulp, chicken broth with salt added, Dr. Pepper, or strawberry popsicle with strawberry bite in it. We'll give y'all just a minute to answer. And the answer is orange juice with pulp, strawberry popsicle with strawberry bite in it. So of course they can have the orange juice because of the pulp, and then no strawberry popsicles because they have strawberry bite inside of it. They are allowed to have chicken flavored broth, and salt is a fine additive. Question 2, what is the longest time this diet should be used? And the answer is 5 days. So we talked about this earlier. The clear liquid diet doesn't offer enough nutrients and calories for a long period of time. So we only want to use it for a temporary period. Which of the following are risks associated with a clear liquid diet? Select all that apply. Aspiration, inadequate nutrients, unstable blood glucose, or unstable blood pressure. And this is select all that apply. Okay, the answers are aspiration, inadequate nutrients, and unstable blood glucose. So aspiration, because these are thin liquids, inadequate nutrients, because it doesn't give enough nutrients and calories for a long period of time, only for that short period, and an unstable blood glucose, because most of them are high in carbs and high in sugars. This diet does not affect the blood pressure. And the last question says, on a clear liquid diet, you can eat popsicles colored with red coloring. True or false? Okay, and the answer is false. And of course, it's false because, again, we don't want any red or purple coloring because they can leave a residue within the bowel that might be mistaken for blood. So we don't want to we want to make sure that our patients aren't having anything red or purple coloring. Okay, so the last slide is just our references, some of our sites and references that we used to gather our data. So if you guys have any questions, you can just leave them below. Thank y'all for listening. Bye.